When cases were skyrocketing last summer, President Joe Biden announced federal workers must get the COVID vaccine. And if they did not have an approved reasonable accommodation, they would lose their job. Western New York's VA notified employees of this back in July, but they're just now starting to go through the process. 2 on Your Side's Danielle Church joins me with some of those details. So, Danielle, why now?
Mary Alice, a spokesperson with the VA tells me it's because of 2 things. 1, they needed more time to process all the medical and religious exemptions. And 2, that was put on pause temporarily until February because of a lawsuit that ended up being tossed out. So now at the Buffalo and Batavia VAs, unvaccinated workers are getting these letters. It tells them they need to get vaccinated or risk being reassigned or fired. A VA spokesperson tells me the goal of the mandate is to increase vaccinations so their patients and employees are safer. 179 VA employees in Western New York have requested an exception to the federal mandate. That's a little over 5% of the workforce here. It's concerning to a Western New York veteran I spoke to who says he's already feeling the effects of staffing shortages within the VA, and a local VA healthcare worker who wanted to remain anonymous out of fear of being fired on the spot says if there are more staffing shortages, it's not going to be easy to replace the staff.
We can't even get enough staff now in a situation where many people are out of work and quite frankly don't want to get into the healthcare field. Not just for myself, but my fellow veterans are the ones that are going to suffer in this whole fiasco that the Department of Veterans Affairs is pushing.
It does take time to learn how to interact effectively with veterans who may be standoffish, need that one-on-one care. It takes time to learn how to be an effective VA employee from all aspects, all the way from EMS up through nursing and providers.
And I did ask a spokesperson at the Western New York VA how any potential additional staffing shortages would be resolved. I was told, quote, similar to regional community provider organizations that have already gone through the New York state level COVID vaccination requirement, Western New York's VA will identify individualized plans for departments to enable continuation of clinical care delivery. Reporting in the Information Center, Danielle Church, Channel 2 News.